our witnesses for your testimony. Just want to echo my colleagues' comments and say from somebody from Massachusetts, obviously where we, coming from a state that has gone through some of these challenges, but a state that now has nearly 100% of all adults covered, or excuse me, 100% of all children covered, 98% of all adults covered, where our rate of cost increase for the overall healthcare system is right in line with our gross state product. That for the risk pools for individuals and for small businesses is about 1.8%, at least current data for the year upcoming. Contrast that to about 10% what it was a decade ago. I think Massachusetts is proudly evidence that if there is a collective will to get a meaningful healthcare reform bill passed and to continue to work on it, to continue to tweak it, to make sure it works together, it can be successful. And to the extent that I'm hearing from my colleagues today, a new refrain of rather than just repeal, but actually repeal and replace, I think we're finally actually getting somewhere. So thank you. With regards to the actual website itself, and unquestionably, needs for improvement, and I want to thank the witnesses for highlighting some of them. I did have a couple of basic questions. First off, is it, Mr. Wright, is it clear that you can actually get estimates about how much you're going to pay for health insurance without having to put in any sort of personal identifying information?
On the Healthsherpa.com site, which has taken it directly from the government site, yes. But when I went through and tried it myself to get to the point to see how much information it would require, I couldn't get to that point without disclosing all of my information first.
So would it surprise you to know that in the past 5 minutes I could log on to the Healthcare.gov website, put in an exchange, put in a county, put in no other identifying information other than an age bracket for me and whether I wanted coverage for myself or my spouse, and click through and get an estimate of various costs?
No, it wouldn't surprise me. In fact, I'm glad that they did it because it means that they learned from the gentleman who created Healthsherpa.com and are learning the consumer.
Do you actually know who they learned from?
No, that's the ones who originally did it. That showed that model of how it should be done.
Okay, so
but I'm glad that they did it.
Well, me too. Now, sir, your testimony, and I take it from the chairman that the focus of the testimony today and the hearing today was, can Americans trust government with the information on the Healthcare.gov website? And Mr. Wright, the testimony that you offered basically broken down into 4 categories: the end-to-end security testing, the user account creation and registration, the cyber squatting, domain name confusion, and insider threat. Is that right? Those 4 broad categories?
Sorry, yes.
And so the end-to-end security testing, those were the overall basic security issues that that many of the people on the panel and you yourself talked about today. That is, every major website or most major websites come under attack for cybersecurity threats. Is that right?
Well, the need for end-to-end testing, yes, and every site is. You must assume every site is under attack.
Yeah, fair enough. The user account creation and registration, if my understanding of your testimony is correct, is that your concern there is that it creates a new norm that could be exploited by other websites, not pertaining to Healthcare.gov. Is that right?
When it was originally done and they required you to give your personally identifiable information up front, that created a new norm that people would use then to exploit, to say this is the way we do it.
Because so many people are accessing healthcare and have signed up for Healthcare.gov that many people has now created a new norm?
I don't know if I'm not sure exactly your point. It would be.
Well, how do you create the new norm?
You establish the new normal by saying this is the way we do it. I mean, it could be 1 people have a registered or 50, but at some point if the government says the speed limit is now 65, it doesn't mean everybody starts traveling 65, but that starts becoming the new norm that you start enforcing against.
Okay. And we've seen that proliferate across, you've seen that now proliferate across other websites and other domains, other user forums. If it's a new norm, that norm is something that now spreads, right?
Well, if it's a new norm, what you do is people who create deceptive websites, or what David was showing, is because you're used to doing that because it's been said that you do that on Healthcare.gov.
Have you seen that yet, sir?
Yeah, actually, just what David just showed.
No, have you seen that spread across? If it's a norm, that becomes the norm, right? Have we seen that?
I think we're probably getting into semantics, and I apologize, sir. I didn't mean to do that. What it was more about, when I said it starts becoming the new norm, is you start setting a standard and people start doing it. Everything starts out with a low level of adoption, then you get critical mass. And if they change it and they do that, you can actually prevent the fraud, which is a good thing, because you reestablish what the norm should be, not that you should give personally identifiable information up front.
And I'm just going to, I know I'm running close to overtime. Thank you for clarifying, sir. The last piece that I just want to touch on, I don't know if any of you, and I don't want to put anybody on the spot here, but applications for passport, where you have to submit or they ask for information, including identifying information, proof of citizenship, proof of identity, off a website. We haven't had any hearings based on the confidentiality or security of those issues. Have any of you investigated other government websites about the use of and the safety of classified or of confidential material?
And I can talk to that. I've actually, one of the examples earlier was around the e-filing system. I've actually done security testing around the e-filing application part, and they've had security embedded into that at a very different type of level. There's actually state laws around the protection around what you have to do around Social Security numbers, and in the private sector, there's what's called HIPAA around protecting against patient healthcare information. So there's laws and regulations around the protections of those, and I've done actual security testing on those in the past, and they have done pretty well.
And you think HIPAA, but we heard a lot about concerns about confidential patient information in the mix-up of electronic medical records. HIPAA.
So there's a difference between compliance and what we call proactive security. Compliance doesn't mean security in any way, shape, or form. But what HIPAA was designed to do is try to put protections in place around patient healthcare information, or PHI. And while that's not not necessarily successful across 100% of the board, I've run into some outstanding medical institutions that have very good security, protect patient healthcare information, and take it very seriously. It's just a matter of negligence versus folks that go on proactive side to actually fix the issues that they identify.
Thank you, Mr. Kennedy.